Hi everyone, happy holidays, and thanks for checking out my vlog, A Dose of Reason. I'm Dr. Shira Doron, an infectious disease physician and the hospital epidemiologist at Tufts Medical Center in Boston. Every week I look forward to answering your questions about the COVID-19 pandemic and sharing my thoughts on the latest news and scientific updates and breakthroughs so you can make the best health and safety decisions for you and your family. You can send me your questions to adoseofreason@tuftsmedicalcenter.org. Please include your first name and your hometown with your question. I'll pick a few questions each week to discuss in the vlog. This has been one of the most eventful weeks of the pandemic. In the last 7 days, we've received a lot of new information about the Omicron variant. Cases of COVID are skyrocketing. The CDC announced yesterday that 73% of positive cases in the US are thought to be potentially due to Omicron. In Massachusetts, that number is estimated to be about 50% and climbing. The good news is that maybe we're closer to the peak of this thing than we thought. The bad news is it's staggeringly contagious. Everyone knows someone, and probably a bunch of someones, who are vaccinated and infected right now. Even being double vaccinated isn't going to protect you from Omicron, though it does protect you from severe disease. Being boosted, however, appears to protect pretty well against even mild infection, maybe as much as 70% compared to being unvaccinated. We still need more data to be able to pinpoint whether Omicron has the same severity as Delta in the unvaccinated, but it hasn't been too bad for those who are vaccinated so far. President Biden announced a plan to improve the availability and affordability of testing, which has been a huge problem, to improve access to vaccination, and to help hospitals manage the latest surge. The same day, Governor Baker announced a plan to use the National Guard to help hospitals. Our first question comes from Gail from Dedham. I've heard that the Omicron variant is much more transmissible than the Delta variant. What does this really mean for the public? Do we need to wear better masks, change our practices, i.e. wearing masks outside as well as indoors? Is there any reason to believe it spreads in different ways than other variants, i.e. on surfaces? Well, Omicron is more transmissible, but it's not yet entirely clear whether that's something innate about the virus, like the fact that it appears to have a shorter incubation period, that's the time from exposure to infection, or whether it's because the world's population just has so little immunity to this variant. People who are vaccinated and previously infected are easily infected by Omicron. Getting a booster dose of vaccine, though, appears to make a big difference. So what should you do besides get a booster dose? To some extent, that's up to you. If you're otherwise healthy, a case of COVID-19 will be like a cold or flu for you once you're boosted. But if you're immunocompromised or elderly or have serious medical problems, it's a good idea at this time of rampant cases to avoid crowds and indoor, poorly ventilated spaces. Surfaces are still not a big concern, but it's probably time to up your mask game. That doesn't mean wearing a mask outdoors, but you want a mask that is not cloth and that filters and fits well. KN95s are often a good choice because they're easier to wear for longer periods than N95s. Our next question came from Ilana from Boston. What's your recommendation regarding COVID-19 boosters for pregnant women? My cousin is in her second trimester and received her second shot of Pfizer in the spring. Would you recommend a booster now? Well, the effect of COVID on pregnant women and their unborn children is something it took us a while to figure out. And now we know that pregnant women are more likely to get very, very sick from COVID. And when they get COVID, they can have a bad pregnancy outcome like stillbirth. Now, 2 doses of the Pfizer vaccine protect well against severe disease, but given how high risk pregnancy is as a condition, and with the rising rates of COVID and how much the Omicron variant evades the immunity from vaccine, I would want to have a booster on board for sure. We now have tons of data showing how safe the vaccine is in pregnancy, so to me, there's no question that's the right thing to do. Our last question is from Anna from Holliston. My sister has COVID right now and wants to visit my parents in 14 days. Is that safe, and should she have a negative test first? Anna, your sister is about the safest person your parents could possibly visit with. Early in the pandemic, the CDC set a period of 10 days for isolation after onset of COVID symptoms for people who test positive. And that was based on really the longest possible duration at which they found people to still have viable live virus in their airway. Most people, however, are no longer contagious far earlier than 10 days, especially if they're a breakthrough case. So I have no concerns about your sister visiting your parents, and I would definitely not do a test. In fact, we find that some people test positive on PCR testing for months, and it has nothing to do with whether they're contagious or not. So the CDC says that once positive, avoid testing for any reason for 90 days. That's all the time we have for this week. You can send me your questions about the Omicron variant, booster shots, COVID testing, or anything else related to the pandemic or infectious diseases to adoseofreason@tuftsmedicalcenter.org. I look forward to dishing out a dose of reason to you again next week.